It's a long talk. Some slides I'm going to go through pretty quick, and I'm not going to go through everything. This is basically, we're touching, it's a very, very broad topic. Okay? It's very difficult to concise and make it into one small an hour talk. So I'm going to try to give you a touch on a broad spectrum and maybe highlight a few key points. Because alternative approaches to pain, the subject they wanted me to talk about is non-pharmacological approaches to pain. The topic of non-pharmacological means a lot of things to a lot of people. It could be from, even including herbal medication is considered non-pharmacological to some people's in there, some mine. So what would it mean? Physical modalities. It could mean behavioral education, massage therapy, synergism, things that we consider not an alternative approaches to non-pharmacological use of approach to pain is acupuncture, biofeedback, homotherapy, hypnosis, manipulation, meditation, relaxation. So why do we use these things? Why would anybody want to go for it? Because they want to feel a little bit more control over their own illness. Some people prefer that because it makes them feel they have some control. Some patients' view is that if they go non-pharmacological and go other routes, they might prevent their reoccurrence of the cancer that they have. It's the perception of the anxiety and the pain patients feel and what they want to do with what they have to deal with. So, chiropractic, if we touch on why people go to chiropractic, it's because it's hands-on therapy, okay? And it's a traditional manipulation and myofascial type of a release. They do it with many things like massage, tractions, using certain modalities, but it's a hands-on therapy. There has been studies done where they found because it can lower blood pressure, this type of manipulations by chiropractic approaches can lower blood pressure by just the matter of relaxing the patient, and therefore some people in this study have been shown that they've stopped using their blood pressure medication. The other approaches that we're aware of is the rehabilitation medicine, physical medicine and rehab approach, which focuses on the body as a whole, as a person as a whole, on restoring their functionality, whether it's in the acute care or subacute care, to address musculoskeletal dysfunction, pain, fibromyalgia, whether it's to address spinal cord injury like patients, traumatic brain injury patients, strokes, and many more. Basic goals are to relieve the pain, to decrease impairment, improve functionality, to minimize their disability so they can become somewhat independent and have somewhat a quality of life. Some of the modalities in physical medicine can be addressed with thermotherapy, hydrotherapy, light therapy, electro, and ultrasound. We'll be going through each one in a few. Sorry if I'm going fast. Fine? Okay. The thermotherapy is a therapeutic effect based on basically helping with hypothermia, analgesia, basically to decrease muscle tone, increase collagen elasticity. General applications is to decrease spasms, low back pain, to reduce the stiffness of joints, contractures, and with osteoarthritis issues. Some of the examples under thermotherapy is use of superficial heat, which is like flutotherapy or hydrotherapy, hot water baths, and radiant heat. And then there's the deep heat, which is use of ultrasound or shortwave or microwave uses. The paraffin baths have been useful in contractures, especially in rheumatoid arthritis, sometimes in burns, and in scleroderma. The hot packs have also been useful in muscle spasms, abdominal cramps, superficial thrombophlebitis, and the disadvantage is most important to know. If you don't get anything out of this, but to learn when not to use it. Disadvantage, you can have potential burn. You can cause skin mottling. It could be permanent or temporary. You can impair if there is impairment in vascular supply. So you need to be careful about if there is vascular supply compromise in the area that you're using it. The flutotherapy is basically used in hands and feet because of the way it's done. It's the best uses for hands and feet. And the advantage is it's just a turbulent mixture of movement and to increase range of motion. It's basically flutotherapy is some people like corn pellets, and you put your hands through a machine with corn pellets floating around in there, and you feel the hot moisture and the massage that it happens. That's why it's only really good in hands and feet. It's a box. Think of a box, and you're putting your hand through or your foot through, and it's a lot of little corn pellets kind of that's flowing around. It helps to mobilize. It's really good for people with carpal tunnel, things like that, and it's very limited use because they need to have the equipment, sterilization, etc. Hydrotherapy, it was big for Hubbard tanks one time. Now that Hubbard tank usage has reduced in use because of the expense, because each Hubbard tank has to be fully emptied. The tank has to be sterilized after each use per patient. So the gallons amount of water that needed to be done and cleaned is too arduous. So it's very few centers have the Hubbard tank anymore. It was mainly used for wounds, burns, and even in stroke patients when they were not able to move around. They would lower them into the Hubbard tank and move their limbs in the fluid area. Radiant heat can be the infrared lamps. It's basically used when patients cannot tolerate hot packs or in rheumatic joints. It's a direct heat application into the joint. Is contraindicated in rheumatic patients. Anytime you have any kind of inflammation or anything going on, you should not have a radiant heat applied to it because it'll just make it worse and cause pain in the area. Again, these are some of the contraindication. It's very logical. If you have open wounds, you're not going to put it into paraffin baths, and you're not going to do it in certain areas. You're not going to do radiant heat if they have photosensitivity or inflammation or hemorrhage. Contrast baths if they have any kind of illnesses, small vessel, whatever. You know, it's a logical thing why you wouldn't use some of these things in certain patients. In hydrotherapy, again, if they have wound issues, Hubbard tank, again, if they have skin infections. Multiple sclerosis patients, as you know, do not do well in heat. Multiple sclerosis patients, if you're going to send them for exercises, you should always put them in the morning hours in a cooler environment. As the day goes on, if the weather gets hot, their pain, symptoms, and functionality starts to decrease, and it becomes more of a arduous situation for them to do anything. So heat is not very good for multiple sclerosis patients. This is a generality. Of course, there's always exceptions to the rule. Then we have the deep heat. It's not used as much, but ultrasound is the biggest one that is now in use, and it's basically a high frequency acoustic vibrations that is applied. There is many ways of delivery, either continuous or pulse. It can be thermal or non-thermal effects. The thermal effects is basically helps distension of collagen fibers. The non-thermal effects helps with assisting treatment in fibrosis, scar, capsule adhesions. And ultrasound is also used like if they have plantar fasciitis. That's been good to use in plantar fasciitis patients, mainly phonophoresis with it's ultrasound with the application of topical medication. You put in a medication on the skin, and then you put the ultrasound over that area, and it delivers the medication into a deeper area. And it's great for people with plantar fasciitis. Again, some of the biological effects: it increases vascularity, blood flow into the area, it increases cell membrane permeability, and it causes relief of spasms, and it reverses some of the conduction block. That's what ultrasound usually does. The biggest thing with the ultrasound, you should not really apply it on surgical sites. Ultrasound indications is basic neuromas. I mean, some patients with residual limbs, they've lost a limb and developed a neuroma, and they cannot put on their orthotic or prosthetic to function, and they develop a neuroma. Neuromas, when they surgically are removed, there are chances that they will regrow back again and come back is high. Ultrasound has been used for that. It has some benefit for relieving some of the pain caused by that neuroma. The limitations, of course, with anyone with fibromyalgia or myofascial pain, it's limited. I'm not going to go through this slide. What I want to go through is with ultrasound, biggest contraindications, malignancies, pregnancy. These are some of the patients you should not be using. On laminectomies, on the site where you have the laminectomy in the back, the contraindication is to use ultrasound for those areas. Then you have cold therapy. There is that can benefit as well. Its primary effect is by cooling the tissue using either ice packs, ice massage. It basically decreases local metabolism, vasoconstriction, and helps reduction in some of the swelling and edema. It decreases hemorrhage, reduces muscle spasticity. The biggest thing is if in the beginning, sometimes when a person has, let's say, a simple example is an ankle sprain. It's usually application is hot, cold. They put them in, the initial thing is put them in an ice bucket. Put that ankle right into an ice bucket, and they do back and forth, and it seems to help reduce the event of the initial onset of the sprain. Contraindications, of course, Raynaud's disease. Remember, in the cold, Raynaud's flares up and they get their attack. Rheumatoid arthritis. If they have ischemia already, you don't want to cause another vasoconstriction to occur. Massage, basically therapeutic manipulation of soft tissue. It can be mechanical, neurological, physiological, or reflexive effects to reduce the pain, adhesions. It mobilizes the fluids, promotes some sedation, and increases muscular relaxation and facilitates vasodilation. In the right hands, massage therapy can be really beneficial. In the wrong hands, it can really leave more harm. Therapeutic goals and indications is basically, as we went through, it's to decrease the muscle soreness, help with some moderation of the pain, facilitate the relaxation, and increase blood flow. So therefore, hopefully they'll have less pain and more relaxed, mobile tissue. The contraindications is basically clotting disorders. Remember, DVT, anybody on anticoagulation, anybody whose platelet counts are below 50, you should not be sending them to have massage because they can bleed. Gout, rheumatoid arthritis, cellulitis. It's a logical things what people you should not be sending to have massage therapy. Traction. Traction is another old method that's been used for many, many years in relieving lumbar or cervical radiculopathy. It's basically pulling. It's an old classic method of pulling and relieving. It's not used as much as it used to be. It's more used with in chiropractic environments they use it the most. It helps, but you have to be careful with the cervical. If they have predisposition of rheumatoid arthritis, make sure their C1, C2, there's not have any subluxation or any other pathology going on before you send them for traction. TENS and E-stim has been used. TENS is now very commonly used now in the pain world. It's a nice little unit. It has benefits. It's portable. It can be taken home. It's easy to wear. It's electro little stimulations. Its waveform is biophasic, and the E-stim is also in a similar fashion in helping with pain. It's a diversion to pain. It's the gate control theory and why it helps. There are studies that say that the TENS unit is not beneficial. There are studies that show TENS unit is beneficial. So it's really whatever helps the patient. The indications is basically you can have it as for postherpetic neuralgia is not really a use of a TENS unit. The people don't really tolerate it. I know it's one of the indications, but they really do not tolerate it that well when it's put on that area that is already very sensitive to a lot of things. So they can't tolerate putting on the pad in the area where they're having already hypersensitivity of the skin. But it's really great for any kind of muscle spasms. It's great for knee areas, osteoarthritis, the knee in the elderly, and they apply application of TENS unit around the knee joint area has been shown to have really great benefits for them and increases their mobility at least. Chronic back pain, myofascial pain, it's yes and no on the myofascial pain. Some people do well with it, and some people say that's horrible thing, the worst thing in the world that they ever had. So it's really person dependent on how you would use it and when you would use it. So more indications. Contraindication is important. If they have sensory impairment, you should not use it in those areas. You should never use on the anterior neck area. Logical. You should never use it on top of where close to the spinal cord stimulator or the intrathecal pump. You're going to throw off the mechanism. Pacemakers, you're going to throw off the mechanism. Pregnancy, you can induce premature labor. So some of these are very logical things that when you should not use it. Therapeutic exercise has been shown to be beneficial if the patient is able to tolerate exercise in helping with the musculoskeletal as well as improving the cardiovascular system. In the musculoskeletal, it helps with the ambulation, improves joint mobility, improves balance. As the patient gets older in the elderly population, balance is an issue. Fall is very important because they forget how to fall and cause injuries to themselves. And osteoarthritis in immobility increases the osteoarthritis, stiffness, and pain. So by the fact of just exercising, whether it's walking or doing something, even just plain walking has been proved to help in overall mobility and reduction of pain for that population. And improving coordination is very important as well. As the population ages, these things become less and less, and they need help with that. Of course, by doing just the exercise itself, it improves the cardiovascular system with the circulation, the respiratory, blood pressure. It has a multi-modality benefits. Again, there are many forms. You have isotonic, isometric. I'm not going to go through the slides where it's going to describe the isotonic or the isometric. It's a little more entailed. Or the proprioceptive, which is really important in persons who are reduced in coordination or have increased falling, And proprioceptive training is very important and should be, if you send him to physical therapy, you should write proprioceptive training. What it does is it makes the patient use other areas to help what they've lost their proprioception, whether it's eyes, hands, what they have lost they're trying to replace. Like if they have a peripheral neuropathy, they're losing sensation in their feet. They're losing the feel of the ground. So if you lose the feel of the ground, when you're walking, you're going to fall because you're losing the sensation. It happens in diabetic patients, it happens in HIV patients, it happens in the elderly. So what do you supplement? If you train them proprioceptively, you have them to put on heavy boots, high-top shoes. So the weight of the foot and the weight of the shoe is going to help them to understand where they're standing in time. Use of eyes, use of hands. So proprioceptive training is important in that kind of sense. You should be writing it on the prescription. And you should also be writing precautions on that prescription. The patient is at a risk for a fall. Basically, assistive devices, there are many assistive devices, and we'll go through them. The cane. When you write cane, they're going to ask you what type of cane. Is it a quad cane? Is it a standard cane? A standard cane, is it adjustable? Is it padded? Or, there are so many variations of the one cane that you have. Walkers, crutches, walker. Is it a roller walker? Is it a non-roller walker where it doesn't have wheels on it? It doesn't have a seated device. Is it a tripod type of a walker? So these are all variations on the assistive devices. Now, the other approaches to pain is addressing nutritional therapy. This is just as important as a topic to help a patient in healthy eating. As the population is getting older, they're losing their taste buds, therefore the way they eat is now poor. They're starting to lose weight. And if you do disease modification type of nutritional therapy for diabetics, their sugar gets better and controlled. In general health issues, this topic is leading to herbal medications. Herbal medications are on the rise usage, and when you address a patient with non-pharmacological treatment options for pain, herbal medications, even though it is a form of medication, it is considered non-pharmacological in the minds of patients. So what's important to remember about herbal medications? It doesn't have regulation. It's not regulated. There is inconsistency in the product, the dosage. There is a lack of standardization. They can substitute ingredients. There is improper processing of packaging. So herbal medications are not, yes, it is safe and it is not safe at the same time. In Mexico City, that was quoted in the New York Times, I forgot where in Mexico, there was a lot of deaths from the use of herbal medications because this one product was substituted by a toxic material into that making of that medication. And so when people started to take it, they got poisoned and therefore ended up in a not pleasant area. Herbs, there are interactions between herb to herb drug usage. Kava, which is used if it's in use with a patient who's taking levodopa. It could increase its off periods. St. John's wort and SSRIs. It can cause serotonic syndrome. St. John's wort is vastly used and has a lot of side effects. It can cause bleeding. They should be careful if they're going for surgery. They should stop St. John's wort at least 10 days prior to the surgery. So just remember, there is no standardization and it's not governed. If you want to look up more herbal medication, get a little more knowledge on what they are. In Europe, Germany has the E-Commission, which has a lot of information on the products of herbs that are available, their efficacies and all of that. It's a very nice area that you can go into and look up. In the United States, there is the U.S. Pharmacopoeia and the National Formulary are dependent sites and good sources for herbal medication areas. The commonly ones that are used now widely is the vitamin E, the vitamin C, the B12, the folic acid. I don't have vitamin B6 up there, iron. A lot of these are very commonly used. The ones that are also now is being starting to use and worldwide, more so now, slowly in the United States, like for energy. We have had studies done on carnitine. Use of carnitine can increase energy. It's pretty safe. No really interaction has been reported. Coenzyme Q10. It also helps with increase in energy. I've used it with my fibromyalgia patients. It's a 50-50 thing. I've had benefits. Some patients have reported good benefit increase in energy, some hasn't. Carnitine has been used with cancer population. In fact, the study was done about 8 years ago. Terry, was it 8 years ago? It's got to be, right? Yeah. It has shown that it had benefits. GU issues, the old standard, the cranberry juice, the blueberry, the saw-palmet, the nettle root, which supposedly reverses BPH problems. But the problem is that patients do read up and do use these. They might not even tell you that they're taking them. Joints, glucosamine now is the big thing. The other thing is capsaicin. It's hot chili peppers. We now use it as Quantenza patch, which is the 8% formulation of capsaicin. It's very painful, but it is also very effective in decreasing pain locally, whether it's postherpetic neuralgia. It's an application of a patch. It's helpful with osteoarthritis. It reduces basically substance P, which is a noxious substance that initiates pain locally in the peripheral. In the respiratory, they've gone as bronchodilators, the slippery elm, the horehound, which sounds really funny, is a lozenge, as a cough drop, but these are on the market, and there are a lot of people who do go out to the stores and look for these in the vitamin shops. Turmeric, curry powder. It seems to be a very good anti-inflammatory, feverfew. I have 3 patients who swear on devil's claw in helping with their pain and their fibromyalgia, and basically that is all what they're taking. Devil's claws is equivalent to, the dose that they're taking is equivalent to taking Mobic. So it's very similar to Mobic. The other approaches are, of course, hypnosis. It can be group therapy or individual. It's non-invasive, non-pharmacological. It reinforces mainly positive goals, and objective is to decrease the anxiety. It's used basically to help comply in therapeutic regimes, control of depression, anxiety, improve self-efficacy, improve sleep, habit control. People use it to come off of smoking, weight loss. It's been used throughout. Now they're saying that it can help with pain by defocusing on the pain issue and focusing on something else by the use of hypnosis. The mechanism they're thinking, it's because of the hypothetical. It is not proven. It's because of the alternation of pain perception at several pathways. It's of the frontal limbic system recognizing the pain focus and attention is going elsewhere. This also has been used before the epidurals for delivery. It was a big thing in the way back when I'm not going to date myself, but it was a big thing in natural childbirthing method, where they would teach you during the part of severe pushing and delivery part to focus on something else to reduce the pain perception, and it had many benefits without having to have the epidural. Was used it did work if you're able to focus during that time period. Then, of course, there's the traditional Chinese medicine, which has been around for ages, and they use a combination of acupuncture, herbals, cupping, massage, Tai Chi. Tai Chi has been known to increase also balance, and it's highly recommended in the elderly population who are losing balance and losing control. So Tai Chi is very good. Meditation, of course, it helps with the relaxation. The risks of acupuncture, I didn't go through the technique of acupuncture. It's multitude and it's expansive. But it's one thing you have to remember. There are risks to acupuncture. It can cause, or if the person is very thin and the acupuncturist is not paying attention, they can puncture an organ. Nerve injury, vascular injury, they can cause pneumothorax, and the site of, if they're not careful with the needles, they can lead to the site where they inject, put the needle in, infection, bleeding, bruising, and of course pain. So there are risks to acupuncture. If a patient asks you, there are risks, so they should be careful on who they're going to and how it's being applied. So all of these things is basically to encourage the healing by fulfilling what is patient's expectation. The biggest thing in alternative approaches to pain is, what is your patient expecting to achieve? What does the patient want to achieve? And you're using it with combinations of one thing. It should not be solely the non-pharmacological. It's a combination of everything to help the patient reach what they want to attain. It's either by prayer. Prayer has a big role in playing in their reaching their expectation. Is it by herbal medications? Is it by massage? Is it by touch healing, which is massage is mainly important in? Is it by a surgery that they might need? These are all a part of the whole care of the patient. Basically, I'm done, but there was a prescription if anybody wants just an idea of what a physiatrist writes on a prescription pad. You know, it's a very unknown field if nobody had exposure to physiatry. When somebody sends somebody for lumbar radiculopathy, low back pain, what are you doing? You're writing on a script pad the diagnosis. The most important of anything in a prescription pad for a physician is to write precautions. If you don't even know what to write on to send to a physical therapist, you should always write your precautions, because that is that prescription pad that's going to come back to you. Okay? If the patient has heart disease, cardiac issues, you should write precautions on chest pain, shortness of breath, drop or increase, severe increase in blood pressure to reduce by 10 points. They should be monitoring that. You should write for precautions on falling. If they have low platelet counts, precautions of bleeding. Precautions are the most important thing. If you do not write anything on that pad but just say eval and treat, you should write your precautions. And the other things we expand as, if you know background is physiatry, you write for modalities, you write for what is the objective, posture, exercise, is it strengthening, is it isometric, is it isotonic type of strengthening, is it progressive strengthening, and home exercise program. This is a very detailed prescription but somebody has to have the background. If you don't even know any of this, I'm not going to stress as much as I can, is to write your precautions. If the patient has low back pain, had laminectomy surgery done, write no ultrasound to the area. If the patient is elderly, fragile, you're sending them for balance training and coordination, and some maybe range. You should write no active range of motion. What's the difference between passive range and active assistive range? Active range of motion is basically the physical therapist taking that patient and ranging whatever limb. Now, you're going to be dependent on the strength of that physical therapist and the fragile patient. There is a likelihood that fragile patient will end up with some kind of an injury. I had a patient who was 96 years old, had rotator cuff issues, went to his primary care. Primary care sent him to physical therapy. Primary care calls me in a panic attack because the patient now has complete rupture of his rotator cuff tendon. What the precaution should write is active assistive. No passive range, active assistive. The patient ranges as much as they can and the physical therapist assists. No passive range of motion. That way you can eliminate the patients being harmed if they're fragile. I mean, if there's other reasons they're strong, like Hector, you send them, they could do anything they want.
Eval and treat.
Yes, eval and treat. Just do whatever you don't need to put precautions. However, it's in other cases, you should always put precautions on anybody who's frail. Thank you.